Thank you so much, Mr. Chairman. That was a great quote, and it was great to see everybody at the White House yesterday. Thank you also to Ranking Member Capito for holding this important hearing to examine important legislative proposals to improve air quality monitoring, including the Public Health Air Quality Monitoring Act of 2022. I was very proud to partner with Congresswoman Lisa Blunt Rochester in developing our legislation, and I'm very pleased that the Congresswoman is testifying this morning as the author of the House version of our bill. Protecting our nation's public health requires achieving clean air for all Americans. Yet our current air monitoring system is woefully deficient, both in terms of capacity and capability. This is simply unacceptable status quo. It inflicts devastating and disproportionate harm on low income communities and communities of color that suffer from higher rates of cancer, asthma, and other diseases just because of where they happen to live. It's outrageous that in the wealthiest country in the world, communities of color are exposed to 63% more air pollution than they create. Last month, I had the opportunity to tour Outfield Gardens, a public housing community just outside of Chicago that is known as the birthplace of environmental justice. Their community leader and activist Cheryl Johnson explained the environmental justice challenges her community faces and finished the tour by showing me the Outfield Gardens Cancer Memorial Wall. On the wall, one can see name after name after name of community members who have fallen to cancer and respiratory illnesses resulting from the cumulative impacts of a variety of sources, creating poor air quality that has plagued the area for decades. This harrowing physical representation of the devastating effects of cumulative air pollution should inspire us all to act. No community, no community should have a wall of fallen mothers, fathers, sisters, and brothers because they were denied one of the most fundamental human rights, clean air to breathe. That's why this committee must swiftly advance the Public Health Air Quality Monitoring Act and other air quality monitoring legislation. Our bill doesn't seek to reinvent the wheel. Instead, we propose building upon the existing monitoring framework to require EPA to implement immediate fence line monitoring for toxic air pollutants at facilities contributing to high local cancer rates and other health threats from dangerous pollutants. This increased mapping will help support local communities on further actions to confront air pollution, better inform local governments and agencies on permit decisions, and illustrate where federal investments will have the largest benefits to health and equity. By increasing our air monitoring network, updating our existing regulations and methods, and improving our data collection and public engagements, we can help to close the gaping holes in our air monitoring systems. Advancing my Public Health Air Quality Monitoring Act is an important first step towards clean air for all, and I look forward to today's discussion. I also want to thank the chairman for helping me introduce this bill as an original co-sponsor, along with Senators Durbin, Booker, Markey, and Warren. Thank you, Mr. Chairman, and I yield back.